I'm Associate Professor Hannah Moore. I'm the Program Head of Infections and Vaccines at the Kids Research Institute Australia, and I'm also an Associate Professor at Curtin University. RSV, Respiratory Syncytial Virus, it's a virus that causes chest infections in little babies and in adults as well. Most children have been infected by RSV by the time they've all been exposed to RSV by the time they turn 3 years of age. But there's some groups of the population that have much higher rates of disease. For some babies, it can be a general mild condition or a mild common cold, but for others, it can actually be quite severe and they can end up being hospitalised for a couple of days. RSV is incredibly common. In those young infants under the age of 6 months, we could have up to 1 in 30 of those infants being hospitalised for RSV in their first 6 months of life. The incidence of RSV does then decrease with age as babies mature, but even when children are up to 5 years of age, we still see quite significant hospitalisation rates, but it goes out to about 1 in 500 children can be hospitalised for RSV. There's only really supportive treatment for children and babies who are hospitalised with RSV. That's about helping them breathe and it's about helping them to feed, and that's why prevention with immunisations is so important.
I'm Catherine Hughes. I am founder and director of the Immunisation Foundation of Australia. We are a patient advocacy charity.
Respiratory Syncytial Virus is a highly infectious and unpredictable virus affecting people of all ages. The virus is passed from person to person in droplets spread by an infected person. Most children are exposed to the virus before they turn 2, sending thousands to hospital each
As a
winter.
foundation, our mission is to protect babies and families from vaccine-preventable diseases, and that includes RSV. So we're doing a lot of advocacy to try to ensure that all Australians who are vulnerable to RSV, including little babies, have access to affordable immunisations for RSV. Ideally, this should be on the National Immunisation Plan. So we believe the National Immunisation Plan is the best platform for RSV immunisations to ensure that we have equitable, easy access for all Australian families. Disappointingly, the PBAC did not recently recommend a infant immunisation for RSV, which is really disappointing because we have seen a lot of success of that immunisation in some of our state programs.
In 2024, across Western Australia, where we've had a immunisation program for RSV, we've seen that there's over 20,000 doses have been given to babies and those young children at high risk, which is great to see. We're also seeing the data starting to show that we're seeing less RSV hospitalisations than what we have in previous years, and it's really trending in the right way that we're going to see effectiveness estimates similar to what was seen in clinical trials, so about an 80% reduction of RSV hospitalisations in young infants, which is just fantastic to see.
Western Australia and Queensland have really led the way with RSV immunisation programs for all infants, and we've seen some really exciting results from these programs, with both states recording reductions in hospitalisations.
Research that we have done here at the Institute has shown that quite a lot of parents have heard of RSV, but they don't understand the severity. So while, say, up to 80% of parents have heard the word RSV, only about 50% of those associate pneumonia with RSV, even though pneumonia, that serious chest infection, is predominantly caused by RSV. So I do think there needs to be some more awareness of the severity of RSV within the community.
Be alert for short, shallow and rapid breathing, where the child's chest caves in between and under the ribs or the lower neck. Up and down head movements or grunting with each breath. Flared nostrils and wheezing. And in some cases, even a blue tint on their lips, fingernails or around their eyes. If you suspect your child has severe RSV, don't delay. Seek urgent medical attention.
We really want the broader clinical community to be aware of RSV, so we've launched the Unite Against RSV awareness campaign, where we've got a suite of resources like posters, fact sheets, videos, podcast episodes all available on our website.
In 2024, for adults aged 60 plus, the Therapeutic Goods Administration approved a vaccine to protect against serious complications of RSV. An RSV vaccine was also approved for use in pregnancy, while an antibody therapy was approved for infants.
We're also providing regular updates on policy changes to do with RSV to clinicians and other providers. So if you're interested, feel free to go on our website and sign up to our emails to find out more.